Hello and welcome. My name is Rio and I'm going to be demonstrating a lip augmentation today on our wonderful patient Amanda. Now before I begin, I just want to tell you a little bit about myself. I've been in the industry a lot longer than I really want to say, but that doesn't really mean anything. If you're in the aesthetic industry, you're going to keep learning and growing, and there's so many new exciting procedures that we're doing now. You're going to love it. Now, lips, one of my favorite things to do, and the patients love it. What I love about it more than anything is not only are we helping to beautify them, but they walk out feeling so good about themselves. And they walk out having just a little bit more confidence. So you get to make an impact in their lives. Now, before we get to the fun stuff, before we get to the lips, we're going to talk about what else can we do in this lower third. So many things. We've discovered so many things that we can do, but what ages us? Is it going to be deflation? Is it going to be bone loss? There's so many things that age us, but there's also things that make us not look the best version of ourselves. As we get older, sometimes what happens is we start to get this little downward turn in our mouth, right here at the corner. So now she doesn't have this, but I'm going to use her as a demonstration here. The corners of your mouth, we have a muscle here called the DAO. That DAO pulls down and it makes us look sad. So we could put what's called a neuromodulator, something like Botox, Zeman, Jeuveau, Dysport. There's many of them on the market, but a little bit of product right into the corner right there where it starts to pull down will help relax that, because it's pulling down, it'll relax it up and give you a little bit more of that smile. So you don't look like you're so sad. What else can we do? This is a real bummer. As we get older, we get what's called the chin cellulite right here. Cellulite of the chin. I'm not even going to try to say the French word for it because it's a really fancy word. Just know that we can also treat that with a little bit of that neuromodulator, some Botox, Dysport, Zeman, Jeuveau. And so what that does, it helps with that pebbling that we get in the chin, helps to also relax that muscle. That mentalis muscle is pulling up and it's creating a crease right here. So we can put a little bit of modulator here as well to really help lengthen that. And she's looking at me like, I want that, I want that. You don't need that. She doesn't have it, but I'm going to just use her for demonstration. And so we can lengthen that chin a little bit. We can also get rid of that, what's called that chin cellulite. What else can we do? Well, we can give her what's called a lip flip with the neuromodulator. So maybe she's not ready for lip filler. Maybe she wants to just have a little bit more red show in her lips. What we can do is put a little bit of toxin right in that upper border of her lips, the vermilion border, just a little bit, and that's going to help turn up her lip a little bit. We're trying to keep it from, it's a sphincter muscle, so we're trying to keep it from pursing, and it just relaxes it so you get a little bit more of a peak. And she's looking at me, yeah, I want that, I want that. But maybe they're not ready for filler, and we can just do a little bit of that toxin in there and see how they like it. The beauty of that is it wears off in about 3 months, maybe a little bit sooner if you talk a lot like me. Okay, what else can we do? My goodness. Well, she's not a very good example because she's pretty much perfect, but sometimes one of the other things that we have is our neck muscles can be pulling down. And many times the neck muscles, these platysmal muscles, they're connected to a muscle called the SMAS that's in the face. So one of the things I would recommend is when you are in a practice that you make sure that the trainer for that company comes out and trains you specifically on their products. I'm going to use a little bit of a firmer product for her because I know she wants a little bit more of a robust lip. And when you understand the rheology, it's a fancy word for just understanding the characteristics of the product, then you'll know what product to use based on the indication you're trying to achieve. What I'm going to do here is I'm just going to draw from the nasal ala down. We really want to keep the majority of the product in between these two lines. If we come out too far, we can make them look a little bit more jokery, and we don't really want to do that. But with her, I don't mind coming out farther. I am going to start in where the nasal ala is and just come down, put the bulk of it into these areas. You have 3 tubercles, 3 on the top and then 2 on the bottom, and those are the areas that I'm going to focus on. And then I'll come out a little bit further just to give it a little bit more length to her lip. Here's her philtrum column here. And I'm just marking them just so that I can see where her peaks are naturally. And then I'm looking to see which side of the lip, if there's any asymmetry. And I'm going to start with the side that has a little bit less volume, which is this side right here. So I'm just going to start off with the fencing technique. And I'm just going to come down just below the vermilion border. I don't want to get a lot of product in that vermilion border because I don't want to have any migration. We find if we stay below the vermilion border that we just have less chance of having migration. And so I'm going to, there we go, just below, just little tiny streams. I'm going to come down to the wet dry border. I'm going to pull back and I'm going to inject my product. I'm going to do about 4 little lines here. And this is really going to help create a height for her. I'm a slow injector. I like to inject slowly. Oh, she's starting to feel that. So hopefully once this product gets in there, that lidocaine that's in the product will start to also kick in and give her a little bit of relief. Okay, get that. All right, coming over to the other side now. Coming down to the wet dry border, I'm gonna pull back. And you can see my needle right here, okay? So I'm very superficial. This is much more superficial than how we used to inject. However, if you have too thick of a product, they're gonna be able to see it. And so you'd really have to pick your product wisely. There's some products that are very, very water loving, very hydrophilic, and there's others that are less. They could be highly cross-linked, which makes them a little bit more firmer. Some are more stretchy. Some are gels, some are particulates. And you can see how her lip is nicely augmenting. Sorry. You really want to make sure that they understand what a vascular occlusion is. Obviously, don't scare them, but you want to let them know if they start to see any blanching, they don't get cap refill when they press on their lip, or they get a very odd, lacy, white, marbly look on their face, anywhere on their face, they could have what's called a vascular occlusion, or they could have a vascular compression. A vascular compression would just be a lot of swelling around the artery or the vascular system, and it's not allowing for tissue perfusion blood to get to the tissue. We definitely want to treat it as soon as possible, so I have not leave town for a couple of days, and if they start to notice that they're not getting that cap refill or they have a vascular occlusion, they come back in. It's something that we can resolve very easily. Now, if they leave and they notice that something looks weird, they're in a lot of pain, and they don't come back, and then all of a sudden they have all this necrotic tissue because they haven't been getting vascular flow. Don't be freaking out, it's not gonna happen. That they don't have that vascular flow, then you need to be thinking about hyperbaric chambers, but the most important thing is you get them in and dissolve it. You're gonna have many, many vials of the Hylenex in your practice, and you're just gonna flood it and dissolve it until you get tissue perfusion back. I haven't had a vascular occlusion. It doesn't mean that it doesn't happen. It happens quite often, especially now we're using so much product in so many different areas in so many different ways. And everybody has different anatomy, especially if they've had any type of facial reconstruction. So it's really important to know what a vascular occlusion is, how to treat it, and what to tell your patient so they know to come back in so you can treat it, and then everything's gonna be fine. So this is a wonderful, wonderful field to get into. I'm really excited for all of you to enter this. This is a great opportunity for you to really make an impact in people's lives. You have them there with you for 30 minutes to an hour, and you get to help them feel good about themselves and kind of find themselves again. Sometimes they need to be restored back to what they used to be, when they were more youthful and more plump, or maybe they just never had lips and they want to have a little lip. They're gonna be on camera, they're gonna get married. So again, you get to make an impact in people's lives. I know for me, when I got into nursing, I really wanted to help people. Unfortunately, with the system and the politics and everything that goes on, we can't always provide the kind of care that we want to provide. And this is a great chance to do that in ministry, to really help your patients look in the mirror and go, there I am, I'm good, and help them have that confidence. So good luck to you. I can't wait to see you all in our school, and we'll talk soon. Bye.